Diabetes can affect the feet in a number of ways, mostly related to where it is, the location in the body, and the fact that it's so far away from everything else and we walk on them. So the biggest thing that diabetes can do is it can affect the blood flow. So many people with diabetes don't have as good blood flow down into their feet and their legs. The long blood vessels can develop blockages, or they can constrict, meaning they narrow, and therefore it can make it harder for the blood to get all the way down into the feet. Diabetes also can affect the nerves, something called neuropathy, which is nerve damage. So many times people with diabetes, they can start to get some damage to the nerves where they'll start to feel some tingling or burning or stinging. But eventually that damage can become full destruction of the nerves and it can become numbness. So there are many people that have diabetes that cannot feel the bottom of their feet. Diabetes also can affect the skin. So many people with diabetes have dry skin, have calluses, cracks in their feet. That's an increased chances of developing infections, things that get into those open areas. Diabetes also can affect the immune system, the part of your body that fights infections, that heals wounds. So many people with diabetes don't heal as well as they should. They can get a cut or scrape and it takes much, much longer to heal than it should, and it can turn into much bigger problems. So when you add all these things together, problems with blood flow, problems with the nerves, problems with the skin, and problems with healing, it puts the feet at very, very high risk. The most important thing is keep the blood sugar under tight control. Work with your doctor, your family dietitian, nutritionist, whoever it is that you work with, your team, to keep that blood sugar under good control. The second thing is check your feet every day. Make sure that there are no cuts, no scrapes, no open areas, no new redness or blueness or color changes in your feet, no new swelling. Anything new, anything comes up, you need to address it very, very quickly. Check your feet every day by looking at them, feeling them. Now, if you can't get down to your feet and see them or turn them up, look in front of a mirror. Put them in front of a mirror. Have someone else check them. Make sure that if somebody, yourself or someone else, is keeping an eye on them to make sure that there's no new changes occurring. And if there are, you get it taken care of right away. Because it's much easier to treat something when it's small and a minor issue as opposed to when it becomes a major issue. Number one, wash your feet very well, dry your feet very well, dry everywhere, make sure you dry in between the toes. Second thing, use a moisturizer on your feet. Tops, bottoms, sides, everywhere except for in between the toes. We don't want to put moisturizer between the toes. That can lead to fungus infections, athlete's foot. Make sure you do not go barefoot. Puts the foot at too much risk. Make sure you're wearing well-cushioned socks and shoes that fit properly. If you have deformities like bunions or hammer toes or other prominences of the bones or calluses, we want to make sure that you're not having increased rubbing or pressure on these areas. Exercise the feet every day. Move them around. Get up and walk. If you can't, or if you're not able to do much exercise, move them while you're sitting. Move them up and down, side to side. Spell out the alphabet with them. Something to keep that blood flow up in there, basically, as well as keeping the joints and ligaments and tendons all loosened up. Other things that you do is just make sure if you cut your nails yourself, make sure you cut them straight across. You can file down the corners, but don't go digging down into the sides. The important thing you also need to do is see your podiatrist at least once a year. Have them check your feet, a thorough foot examination to make sure that no problems are going on, and if you do have any issues, that we're keeping them stable. Many insurances will cover for a foot exam, as well as for foot care, and even special shoes and insoles for people with diabetes. And also, if any problem does develop, see your doctor right away. Call your doctor immediately or call the podiatrist and have it checked out, because once a small problem is there, we can take care of it. If it becomes a bigger problem, it becomes much, much harder to take care of.